Welcome to Living Healthy, where we are here to help you make sense of a nonsensical healthcare world. My name is Dr. Barton Bishop, and I am the Chief Clinical Officer of Sport and Spine Rehab. I'm also a board-certified sports physical therapist. My co-host is Dr. Jay Greenstein.
Hello there.
Hi. CEO and founder of Sport and Spine Rehab and an all-around fantastic chiropractor. With us today we have Dr. Victor Abdow, who is a nationally renowned pediatrician. He happens to be my children's pediatrician, so I have a special affinity with him. And it started with, obviously my wife getting pregnant. And we had a great ability to be able to choose the pediatrician we want because of my position with Sport and Spine Rehab. I was able to really pick the best pediatrician, and from the second I knew that we were having children, I knew it was Dr. Abdow. The funny thing is, my wife, like most mothers, as we'll talk about today, they can get a little bit on edge when it comes to the children and making sure that the children are doing well and meeting their milestones. So I play a nice, fun role of balancing my relationship with Dr. Abdow and my relationship with my wife and children. So anyway, welcome, Dr. Abdow.
Thank you very much.
Yeah, thanks for being here. So why don't you tell our audience a little bit about yourself, where you were trained and all that?
Well, I grew up in Washington, D.C., went away to college at Purdue University, came back to Georgetown Medical School for my medical school training, and then also did my residency at Georgetown for 3 years, and then stayed on and did an additional year as chief resident at Fairfax Hospital. And then practiced 3 years in Reston, Virginia, and then settled in Rockville, and I've been practicing for the past 15 years.
Awesome.
And an impressive practice,
Absolutely.
I will say. So, Dr. Abdow, as a pediatrician, what are your biggest concerns about children's health these days?
The biggest concern that we see is continuity of care, that we get to continue to see a child from start to finish. There's so many changes with insurances and things like that that parents these days have to kind of choose a pediatrician based on what insurances that they take. Fortunately, I take quite a few insurances, so I'm able to have that continuity with my patients. Probably the biggest issue that we deal with these kids is obesity, and I think that's a huge problem that we need to address and really get on top of, because so many health issues come out from being obese, and diabetes is probably the number one problem, heart disease being, number two.
I'm curious to know, because, we know it's a huge issue. What percentage of the parents that come in have the same problems as their children?
Oh.
And then how do you deal with that communication to kind of get the point across, like, hey, you're not maybe setting the best example. How can we improve your health and your child's health at the same time?
I would say a good 50% to 75% of the parents that have obese kids are obese themselves.
Mm-hmm.
Wow.
And so a lot of times you have to handle the subject delicately, but you really have to kind of hone in on the health issues that the parents are having and say, look, you can spare your child these health issues by working on this now and getting them into a good exercise and diet routine. And a lot of them are pretty receptive, and now there's a lot of help in the community that we can kind of get them into getting into shape down programs and things like that, where we can get them learning about nutrition, exercising regularly. I mean, I tell the parents right off the bat, get your child shaking and moving for 30 to 40 minutes a day, get them off the sofas, get them turning the computers off, the electronics, because that's probably the number one problem for the reason we see that kids are very, overweight at this point, is that they're just inactive.
Who would have thought that 30 years ago we'd have a television show with a pediatrician, and one of the first things out of your mouth would be you would be concerned about type 2 diabetes and heart disease? I mean, in children, it's an obvious epidemic. Our first show was about getting fit through weight training, strength training, and just fighting obesity through fitness. And we talked a little bit about the obesity epidemic that we have. So it's great that you're fighting it. That 30 minutes of shake and move sounds like a good thing to do.
A good slogan, for sure.
Well, I mean, if you just get them moving, get them up, and that's the start. The biggest hurdle is to get them to change what they're doing and getting them being active. If you start with even 15 minutes and then work up, but, for good cardiovascular health, you need to be doing something for 40 minutes or longer in order to do that. And weight loss comes with it if they just make some mild modifications. It's so much easier to lose weight when you're young. It's harder as you get older. And for me, I was overweight as a kid, and it wasn't until I was in high school that, a reality check happened, and I ended up watching what I was eating, exercising, and, lost over 50-some pounds.
Wow.
And kept it off for many, many years.
That's
So.
awesome.
Great, yeah. So you mentioned some programs out there. Could you tell our audience about some of the effective programs that are out there in the community that can help their families?
Well, getting them into a regular exercise program where they are doing something consistently, maybe getting a nutritional consult to speak with somebody who can teach them how to choose the right foods. Also, some of the parents need some guidance on how to cook foods and what oils to be using and how many fruits and vegetables they need in the diet and what things to eliminate. I tell a lot of the parents, if it's white, they really shouldn't be eating it, and, that they should be eating things that are more complex, like brown rices, multi-grains, whole grains, things like that. So, you just have to try to teach them a little bit, about what changes to make, and usually it helps.
Sure.
Go ahead.
Sure. So very curious to know, besides maybe some of the dietary and exercise lack of adherence that the parents and maybe the kids are going through, what are some of the other mistakes that new and or existing parents make?
Searching the web is one. You give advice about certain things, or their child has certain symptoms, they'll immediately Google or search on the web, certain things, and then they'll come up and they'll call you, and they already have a pre-diagnosis in the back of their head that my child has XYZ because I looked it up online, or
Sure.
They'll read something that may not be a reliable website, so they're reluctant to do, say, vaccinations or something because they've read something horrific that they happen to see online. Other things too, textbooks. Textbooks are great as a source to give you information to help guide you on how to raise your child and what to do, but they're not cookbooks and recipes that you need to follow exactly. Every child is different and should be treated differently, and so every situation, is different when it comes to making decisions on how to raise or how to treat or do things. So I always try to explain to parents that, we're here to help and guide you, but don't rely on external things like the internet or books as being, the Bible of how you should do things.
Makes total sense.
You mentioned vaccinations. Let's talk about one of the big hot button issues is vaccinations and autism. And you see bumper stickers on cars. No immunizations for me. And what are your feelings on that?
Well, my practice is a pro-vaccination practice. I truly believe vaccinations are beneficial and that we've prevented a lot of deaths from different diseases over the years. We've eradicated smallpox based on the fact that we vaccinated people against smallpox. Wards were filled with children with meningitis many, many years ago from Haemophilus influenza, from streptococcal meningitis, Haemophilus influenza. We've eradicated a lot of those cases of meningitis just by vaccination alone. So vaccines, when we see, no illness, parents are reluctant to want to vaccinate because they look at what the potential side effects can be. And if somebody has published an article that said there's a link of autism to the mumps, measles, and rubella vaccine, or to, say, the preservative that's used in the vaccine, which is thimerosal, which is a mercury derivative, then they jump on this bandwagon that we shouldn't be vaccinating because we're not seeing the disease. Well, the problem is you stop vaccinating, the disease comes back, and then everybody's screaming for vaccination again, just like with the swine flu. They predicted that we were going to have a bad swine flu, that there were going to be a lot of deaths, and people were lined up from, for blocks, at public health clinics to get the swine flu vaccine. We ran out.
Yeah.
And I am pro-vaccine, when it comes to immunizing against influenza and stuff like that. And the biggest problem is when there's no disease, then people focus on the potential side effects from the vaccines, and they just don't want to vaccinate. So I have a very tough policy in my practice that I vaccinate. I do use vaccines that are preservative-free, so that we do eliminate the thimerosal so that they can get preservative-free vaccines. The study that was done that showed some association between MMR, that physician in Great Britain actually falsified the data. He lost his license.
Wow.
So they were able to refute that information and, disprove that there was any connection. So we just try to educate our parents about that. And if they choose to not vaccinate their kids, then we just say, maybe this isn't the best practice for you, but I'm here to protect your child and do what's in your child's best interest.
So, given that there's some conflicting research, and we have Jay and I are researchers, and there's a big confusion over correlation and causation. Why do you think that there's such a rise in the diagnosis of autism and autism spectrum disorders?
Well, I think we're doing a better job of diagnosing now, and I think it's a multifactorial cause. I think that there are environmental influences plus a predisposition from a genetic standpoint that you have autism. And sometimes there may be things that are done, and there may be the possibility that a vaccine might have triggered that turning on, which may have, but that child would have had it anyway. Mm-hmm. So I don't think the vaccines themselves actually caused it. I think that there was already a predisposition for that child to have that.
So you mentioned the preservative that might have been a causative factor, and you've removed that from your practice, and I think that's fantastic, and it's good for the parents to know out there. What might be the other triggers, those triggers that might cause that early predispensity for this to show up a little bit earlier?
Well, sometimes you can get a history that there may have been a reaction to other vaccines. So, if a child has more of a serious reaction to a vaccine, a high fever. In the past years, we used to use something called DTP, which was diphtheria, tetanus, and pertussis. And they found that the pertussis component in it, if it was whole cell, actually caused significant side effects. And some kids actually had high fevers, and in some cases had seizures related to it. And they recognized that, and then they actually came out with a new form, which is an acellular form of pertussis, and we're seeing far fewer side effects related to it, and neurological issues. But when you have a bad disease that's killing children, and you have to come up with a vaccine, you hope that they come out with one that's going to be effective and not have side effects. And I think over the years they keep looking at and honing in on, making vaccines better. And for those parents who have an issue with vaccines, as long as they're willing to vaccinate, I actually will work with them to alter the immunization schedule a little bit to kind of separate things out if that makes them more comfortable not giving their children too many vaccines at once. Because I guess also people out there feel that you sometimes overstimulate the immune system by giving too many at one time. And so I can understand that. But at the same time, I want their child protected, and so I will say, we can split these up a little bit, but we still need to come up with a schedule so that your child is adequately immunized by a certain age. And as long as they do that, I'm willing to work with them.
That's fantastic, great. Yeah. Great information. So we're going to come right back, and you're going to learn everything there is to know about ADD and ADHD. So with our friend here, Dr. Abdow, please come back, and we'll learn a lot. Thank you.
I'm home, and I love it. I'm home, where I belong.
It's always nice to come home, but many Americans are at risk of foreclosure and losing their homes. Making home affordable from the U.S. government has already helped over 1 million struggling homeowners like these. The sooner you act, the better chance we can help you.
I'm home, where I belong.
Welcome back to Living Healthy with myself, Dr. Barton Bishop, Dr. Jay Greenstein, and our guest, Dr. Victor Abdow. So as Dr. Greenstein mentioned, we're going to talk a little bit about ADD, and I need to know if I have ADD. So what are the signs and symptoms? Well, probably more you. What are the signs and symptoms we should be looking for?
Well, with ADHD, we use certain forms and diagnostic criteria to be able to aid in our making a diagnosis. Typically, for a child, the symptoms can be a lot different than with adults. Most adults tend to be more inattentive and not have the hyperactivity component to it. So when you look at the symptoms, it's kind of broken down into two categories. You look at the inattentive component of it and then the hyperactivity. And so when you look at the questionnaire and so forth, there'll be a component that'll say, well, fails to pay close attention to detail, makes careless mistakes, tends to put things off to the last minute, doesn't pay attention, And then when you go to looking at the hyperactivity, the child fidgets, squirms in their seat, can't sit still, is disruptive, blurts out answers before they're asked to give an answer to a question, can also be very disruptive to where, the teacher's having to kind of redirect them constantly back on task and so forth. So the key thing is that you need to see these symptoms in both a home, work, or school environment. So, depending on the scenario, it needs to be present in two separate environments to be able to make the diagnosis.
So you have, if it's a child, for example, you have the parent and the teacher.
Correct. Anybody that works with the child, the more input you can get in from, people who are working with the child on a, one-on-one basis or even in a group setting, the better you're going to be able to make the diagnosis, so that if there's 5 teachers and 2 parents and maybe a tutor or whatever, that's really helpful, because then you can really compare across the board. Is this a global issue? Is this happening in each and every setting? And if so, that only helps to solidify your diagnosis.
So how often in that setting do teachers and or parents not agree?
It's rare, but it happens. Mm-hmm. So that if you have a child that is having only issues at home or only issues at school, then you have to really look at the environment they're in. Is it a dynamic between the teacher and the child, that it's just a child that the teacher doesn't really get along with, or that the teacher's having issues with and maybe raising some red flags, but there's no issues at home? You can't really make that diagnosis, and so you have to tease through that and work with parents to kind of maybe say, well, let's wait and see and get them into another environment and see if we see, a similar pattern. Because usually if they change teachers, the problem goes away if it truly isn't a problem with ADHD.
Now, what happens if there's actual disagreement between 2 parents? One parent says,
That'll
yeah, I'm
happen.
observing this, and the other one says, no, I don't really think so.
That'll happen. You usually will have one parent that will tend to be in denial that their child has the symptoms. Mm-hmm. And so they'll tend to score their child a little bit lower. But when you look at maybe with the other parent and then the teachers, and everybody's giving them 3 pluses on a 0 to 3 scale, and one parent's giving them maybe 0s and 1s, you have to kind of discount that. Just like if we get feedback from teachers and 5 teachers say there's an issue and one teacher says no, you look at the subject, number 1, but number 2, you just kind of discount that, because if there's one that's so far out of left field that isn't comparable to the others, you just have to say, okay, what's the situation there? And a lot of times, music, PE, art are subjects that these kids are able to be focused and still do well and not have issues. So you really want to be looking at certain core subjects like math, English, history, and then parents at home struggling with the homework, because the homework is a big issue. If parents have to keep sitting on top of the child to get them redirected to getting the work done and spending hours getting the homework finished, that there's a huge issue.
Makes sense.
Math, English, history, also known as the fun subjects. So what can we do about treating this? Medicines?
Well, typically my approach is to really look at the child as a whole. So I kind of tell the parents that I would like to do a complete evaluation. I will do blood work to screen for thyroid disease, because sometimes thyroid disease can mimic or look like ADHD. We have to look at, could there be certain learning disabilities that are going on with the child that could be causing them to be ADD. So we certainly want to investigate all those avenues. But clearly, if the forms come back consistent with ADHD, and it's in 2 separate environments and the parents are struggling, a lot of times then we will say, well, let's make a recommendation to do a trial of medication. But at the same time, I talk to them about diet and behavior modification, because sometimes making certain eliminations in the diet, such as refined sugars, again, prescribing more complex carbohydrates, and just getting rid of the junk and the candy and all of that, that will help with the hyperactivity, and sometimes that's enough. But most of the time, that's just helps to fix the problem to a degree. There's still going to be major issues, and eventually, at some point, you might have to consider medication. And then when we do, we talk about the different ones that are out there, and what we're going to do to monitor things, and what to look for, and how we're going to follow up over time.
we were talking before the show about some of the different medications, and that the difference between how you treat ADD and ADHD is almost the same, but you were saying about some of the tendencies that a patient may have towards hyperactivity. You might steer away from certain medications if they're having trouble sleeping. Can you go into detail on that?
Well, a lot of times when you look at the child and you look at the symptoms, ADD and ADHD, I mean, the difference between the two is one is going to be an inattentive. So ADD is usually just your child who has inattention issues. And for the most part, we see that mostly in girls. Boys tend to be combined type, hyperactive and inattentive. So when you choose medicines to treat them, the medicines are pretty much the same. You can't really predict whether one is going to work better for one category versus the other. But if you have a child who already is having issues sleeping and eating and is underweight and so forth, that would then make, a difference in which medicine I would recommend or select to treat that child, because, some medicines tend to have a higher side effect profile than others. And with parents who are already worried about putting their child on medication to begin with, if there's going to be certain side effects that they are going to see, they don't usually do well with that. So you have to kind of educate them about that, and then I tend to pick the one that tends to have the fewer side effect profile.
And what are the most common side effects that they might see?
The biggest one is appetite suppression, and then the other one is sometimes trouble falling asleep at night. Some kids might have some stomach aches or headaches with it, but 90% of these kids that are put on these medicines, if it's used properly, if it's dosed properly, if they take it regularly, most of the side effect profile, especially the appetite suppression, goes away within about 2 months. And then these kids do well. They gain weight. They're able to be focused. They're able to pay attention. And they just academically do much better, and the parents are very pleased with the end result.
And are these medications that they should just be taking during the school week, or should they also be on them on the weekend as well?
No. In my feeling, in I think current thinking out there in the community, especially amongst people who specialize in ADHD, is that this is a medical illness, just like if you had high blood pressure or diabetes. This is not something that you just take when you need it. You need to be taking it 7 days a week, 365 days a year.
Makes sense.
Yeah, so what are your thoughts on some of the more holistic approaches and natural health approaches towards treatment of whether it be ADD, ADHD, or ear infections? What are your thoughts on those?
I'm very agreeable to parents when they come in and want to talk about looking at holistic or homeopathic treatments for their child, because I can understand. I am certainly very conservative when it comes to using antibiotics. And so when I have a child that comes in and I see an ear infection, but the child isn't, say, symptomatic with fever and ear pain, I will tell the parent we have time to wait and we can try other things to see if we can get rid of the ear infection. And that goes with colds and other types of illnesses. I've told parents that if they want to look at other alternatives, as long as they're safe and that they're somewhat proven out there, that there isn't going to be harm done by that, I'm certainly willing to work with them in doing that. As a matter of fact, I've had some parents that have chosen to seek alternative therapies for ADHD, for behavior, for other issues, and have gone and seen auricular acupuncturist, even chiropractic care.
And do they get results?
Yes, they do.
Yeah, and it's something that, you don't see them back needing your treatment again. They do well.
Correct.
Yeah.
And I've had my own personal experience where I had issues with my back, and I went through all the conventional therapies to get treated, and it didn't work. And it wasn't until I went and saw a chiropractor that I was actually able to get relief and be symptom-free within 6 weeks.
I've never heard that before.
Yeah, that's the beautiful thing about
I hear that a lot.
about what we get to do.
Absolutely.
Exactly.
So what would you say is your biggest surprise as it relates to complementary and alternative medicine in terms of outcomes that you've seen in your patient population?
To me it was no surprise, because when I got relief myself, it only made me even more of a believer and gave that as an option to patients to seek that type of treatment. Mm-hmm. And a lot of the parents would come back and said, I really appreciate you making that recommendation because it really helped. It kept my child from having to go through maybe unnecessary treatments or unnecessary pain or surgery.
Or antibiotics.
Or antibiotics, absolutely.
That's great. And what are the most common things that you're seeing patients looking to get more information on? Homeopathy, chiropractic, acupuncture? Is there an area where people are looking at?
No, I think
more?
they look at any alternative therapies out there in general. I mean, I'm a big believer, especially with the kids that play sports, is to getting them involved in physical therapy to rehabilitate their injuries, because that's going to be the best thing to keep them from having a serious injury down the road.
Absolutely.
So you have children of your own. You have a couple beautiful young kids. And how has that shaped your treatment, as being a physician? How has that shaped you?
Well, it's been a humbling experience because, when you go through training, you're kind of like I discussed before, you're taught how to make a diagnosis and treat a certain illness, and it's almost kind of like a cookbook approach. You learn about it, but you don't know what you're dealing with until you actually experience it. When you raise your own children and deal with some of these issues, you learn quickly that, sometimes you have to make adjustments and tailor treatment based on an individual basis.
Absolutely.
That makes sense. So tell us about some of the educational resources you have available for parents in your practice.
Well, we use a system. We have an electronic medical record system, so it comes equipped with already information that's been put together by the American Academy of Pediatrics, by other reliable sources, so that if your child comes in with croup or with a certain illness, Osgood-Schlatter, for another example, I'm able to print up handouts that explains to them what the process is, what the treatment is going to be, and when they need to call back if it's not getting better. So we try to educate people by giving them information about their illness and what to do and how to treat it, and then when they need to follow up if we need to refer them out. I think one of the things that we try to do at each of the visits, as well as provide them with the printed handouts, is just to educate them in general about things. I mean, one of the areas that people tend to call in most frequently about and seem to get most upset about is a fever. And fever is not something to be afraid of. Fever is the body's normal reaction to help fight infection. And most of the time the infection that your body is fighting is a virus, and so some fever is good, and so you have to educate people about when you get concerned, if it lasts a certain amount of time, or if it gets to a certain temperature, or if it doesn't respond to certain medications, then that's when you need to worry.
So probably 20 seconds left. What hospitals do you have privileges at, and how can people learn more about you?
Well, I have privileges at Shady Grove and Holy Cross Hospital, and they can either reach us at our office number, which is 301-468-6171, or my email address is vabdow@hotmail.com.
Folks, another phenomenal guest, Dr. Victor Abdow. Thank you so much for being here, and thank you for joining us on Living Healthy. Next week, stay tuned. We've got one of the world's best plastic surgeons. We'll see you then. Thank you.